Good evening. This is the January 2025 meeting of the Community Service Committee for the City of Norwalk. The attendance is as follows. Councilperson Heather Dunn, Councilperson Ann Worthenstrand, Councilperson Doug Sutton, Councilperson Greg Burnett, Councilperson Barbara Smith, and Councilperson Dewan Wiggins. Is there anybody for public participation?
Yes, we do, Madam Chair. Miss Diana Laricella. I'll
Okay.
let her in.
If you are going to speak to this evening on public participation, we ask that you state your name and your address and adhere to our 3-minute rule. Ms. Loricella.
Thank you, Chairwoman Ayers. For the record, good evening, staff as well as committee members. My name is Diane Loricella, 21 Little Fox Lane. I wanted to thank the Community Services Department and this committee for all the good work we're doing. A lot of challenges coming up in the future because of the federal issues. But tonight I wanted to just briefly speak in my 3 minutes about the following 2 items on the agenda. Having to do with the budget. For a long time, I've on occasion appeared at the Board of Health meetings and have spoken with the health director. And I do look forward to speaking to the bureau chief, Sir, as well as Deanna Diamore. I wanted to make sure that there is enough money in the budget for to ensure that we reduce that prevention is paramount related to the need for additional infectious disease outreach using creativity to make sure that we are utilizing posters at places where people congregate, at supermarkets, etc. I've had difficulty in laying out that information or actually seeing it come to fruition. It's been a 4-year slog, and I'm hoping that we can use more time and effort, have some of you be spokesmodels about reducing infectious disease outbreaks that we will have this winter and throughout the year. I also would like to make sure there's full-time lead inspectors and toxic material inspectors that are funded fully. Right now, there is only a part-time lead paint health inspector, and the health department apparently asked for it, and we're told no. So I feel that it's very important, much more important than beautiful murals that are on West Avenue. That money is needed for enforcement and inspections. I also think there needs to be more masking, free KN95 masks put in the budget because I don't think there is enough of that. Lastly, I just wanted to say, when it relates to the library, which is under your control as well, or your overview, and that is I, as a longtime resident in Norwalk, am awaiting the main library to be renovated. And I do feel that I would like to know what the status of that is and why it would not be in a capital budget request to get started unless it already is. But when are we going to see some renovation taking place? And why are we extending a 2 to 3 year contract for what was known as the First Taxing District business building? That's going to be discussed and decided on tomorrow night under Economic and Community Development Committee. But all it will do is delay renovation of our main library. We deserve a library like Darien, Westport, New Canaan, Ridgefield. They've all renovated their libraries. I think it's time for Norwalk to have a renovated library. Thank you.
Thank you, Ms. Loricella. Are there any other people ready for public participation? Seeing and hearing none, we will close public participation at this time. Going back to my agenda. The next, we will have the acceptance of the minutes from the November 20th meeting, 2024. Can I get a motion? Ms. Heather Dunn, Councilperson Heather Dunn. All in favor? Show your hand. All opposed? Councilperson Wiggin, are you voting? Abstentions? We'll give the option first.
I'm sorry. I'm voting for it.
So it carries unanimously. Thank you, sir. Next will be the meat and the main part of our discussion for this committee tonight. We have had to postpone this presentation for the last 3 months just because other things that we deemed was necessary and important. So I will turn it over to the chief of our community service and his capable team, Chief Daniels.
Thank you. Thank you, everyone. Good evening, everyone. For those that may be watching or watching this later on, my name is Lamont Daniels. I serve as your Chief of Community Services here for the great city of Norwalk. And good evening, Madam Chair and members of the committee, and thank you all for tonight. We appreciate the opportunity to share with you our proposed budget. As a reminder, I just want to kind of share some context. This is the proposed budget, and we have already had our first iteration with the CFO, where we outlined our requests and addressed questions regarding any increases, decreases, and other change to every line item. Over the past several years, under the leadership of the former CFO, we've carefully reviewed past spending, particularly over the last 3 years, with a clear understanding of the unique challenges presented by the COVID years. We recognize that the pandemic limited some of our activities due to inventory delays and order restrictions and other factors. And so while some allocations may not have been fully spent during that time, it's important to consider the context of COVID and how it impacted our ability to utilize the resources. With that said, we've had the opportunity to work with our new CFO, Mr. Jared Smith, office to develop our new pro forma, allowing us to take a closer look at past spending and have a deeper conversation about what's needed to meet our goals. And that meeting was held last year. As always, we are mindful of finding areas where we can trim the budget while also staying true to our mission. So tonight, we want to focus on sharing the goals and priorities behind the proposed budget, explaining the key drivers for any changes that will be presented tonight, and then also, of course, make sure we have time for your questions. The Community Services Department under my leadership is committed to maintaining a balance between fiscal responsibility and our mission to serve the 92,000 residents that call Norwalk home. I'm pleased to join today by the entire team. This is our leadership team, who will be introduced throughout the presentation tonight and will also provide deeper insights into their specific departments, highlight any budget adjustments, and also share some of their overall goals. And we work to be really succinct because this can be an all-nighter if we really wanted to, but also wanted to make it meaningful both for this body, but also for residents who may have interest in our goals and priorities. So we'll proceed just to let you know how we've planned tonight. We'll proceed department by department to explain the reasoning behind the budget request and how they align with our objectives for this year and in some future goals. This is specifically on operational. We are not presenting on the capital budget for the purpose of this presentation. Our department serves many Norwalk residents, and so in closing, we take the responsibility of managing taxpayer dollars seriously. Our services primarily support the city's most vulnerable residents, and whether it's through the health department, the library, or human services, we strive to provide the help people need, especially when they're facing difficult circumstances, while all maintaining dignity, respect, and high quality customer service. So it's also noteworthy that particularly within the health department, there are certain state statutes and regulatory requirements that we must adhere to by law. These obligations often drive unavoidable increases in cost, and we have limited control over those aspects of our budget, and our health director will expand on that. So the community services, I often say the community services department is the heartbeat of the city and is integral to improving the quality of life for our residents. Thank you again, Madam Chair, and I look forward to the discussion ahead. And with your permission, I'll be ready to share my screen and we'll get rocking and rolling.
Lamont, it's I don't know who's responsible. Teresa's in the waiting room.
Who's
I don't know. Move her over.
Teresa, you have to change yourself to guest if you want to move over. I mean, you have to change your name from guest if you want to move over. I can't control that part.
It says Teresa in the waiting room. I'm assuming that's her.
Yeah, but it's guess. Here we go. Thank you. Thank you. Thank you. Thank you. Thank you.
Okay, so you can continue.
All right. Just bear with me. I got a new computer system, as I pointed out. I got like 3 screens looking at me right now, so I'm a little fancy. Give me one moment. And I did practice. All right. I want this one. Can you all see that?
Yes.
Fantastic. So you may see me look to the right because I have this whole 3D thing. So just bear with me tonight. I'm still trying to figure out the best configuration. So we'll walk through this, and the directors will speak throughout it. And I think because it may be easy that after every department, or I'll yield to you, Madam Chair. Do you want us to go through the entire presentation, or from department to department once they finish before we transition to the next department? If there's any questions, I'll yield to you for direction on that.
I know you and your team have worked very diligently for this presentation. So what I would ask my colleagues is I got my piece of paper, jot your notes down as you go through, and then because we don't want to mess up their succinctness, we will address all questions at the end, please.
Thank you. So I'm ready to begin when you are.
We're ready.
Okay, great. So this is Norwalk and council members. This is the team. Myself, as you know, we're joined by Sherelle Harris, our library director, Deanna Demore, our health director, and Anna Vivian Estrella, the human services director. So we make up the leadership team of the community services department. Our overall mission is to increase and sustain the social well-being and health of all Norwalk residents. And I would like to say that this actually was approved during our efficiency study, and they articulated in the study that this is exactly encapsulates what we do. And we know mission statements are not to be long. So this encompasses all we do within the department. So when we think about the community services department, we play a vital role, as I kind of pointed out in my opening remarks. The health department offers a wide variety of services, including our immunization, health education, disease prevention, clinical care. And as we know, 3 years ago, the public health department and public health departments across the country was put on a spotlight, so that I think now members know, in our country know, and residents know all over that what was really the real role of public health department, and we saw that with COVID. And again, just want to always recognize the work of the health department. We have been cited and referenced through the governor's office, through the Commissioner of Public Health, for the great fine work that Deanna and her team did during our most trying times. And then we have the Human Services Department, and those that have been around camp long enough, this is our most new department. It was during the alignment where the Human Services was developed, and some of our existing programs were then put under the early childhood program. And as again, get kind of a little historical, I kind of served as both the human services director and the chief of community services. Then we had an employee, and then Anna Vivian, and she has just really given it life and enhanced kind of the vision and strategies. And it makes up our early childhood programs, our Fair Rent, Community Resource Hub, and I'll let her, brag about that when she speaks about our award, our ADA support services, our elderly services, and our youth services. So these programs really are the nuts and crux around residents coming in asking for help. And then our public library under the leadership of Sherelle Harris, the cornerstone of our community. And, we like to think of the library not just being a place of books, but a place of safety, comfort, access to resources, information, services, and cultural programs, which offers, lifelong learning. And again, she'll be able to give a shout out to some of the great things that they're doing over there. And so part of our internal process, we were asked, and we've done this every year, so I'm really excited to kind of present this in this way. So we all get that large book I don't know how many residents or how many folks really read it, but this information is always archived in this, but I'm really excited to be able to present it in this way. So these goals are not every department's goal. Again, from my, as the Chief of Community Services, what I look to do is look at how all these goals align with each other as one department, how we integrate, and which again, leaning back on the efficiency study that while we have all these services, how do they all speak together? How do we work together? How are we not duplicating services? How we're not looking at resources? We learned that with COVID, if we all needed those plastic things as a department, prior to the new alignment, every department was kind of doing its own thing, using our purchasing power to really look at how we're spending, again, taxpayers' dollars. So these are our goals for next year. Some of them, we carry over because these goals are sometimes ongoing, but to give you a sense of, how I'm thinking, how we as a team are thinking about our organization, about our departments. Number one, improve access to services through technology and data. I mean, we have AI. I don't have to speak to that. We're looking at some of our systems, and I think again the efficiency study really spoke to we got to figure out, as a city, but also from department, how do we look at technology? And technology is not cheap. It's costly. But even for us, how do we expand our digital services through our library, through our own internal systems, and they can all speak to that. But we all have a data technology goal around whether it's increasing our data through the human services, our data and access for online services for our residents. Sherelle can speak to, we want to incorporate our texting system so folks can get text. So really just looking at best practices from all that we do, and thoughtfully, how can we incorporate some of that, with the budget and thinking long term, whether it's this year, next year, and then leverage which speaks to our data. I think I always lean on President Barbara and Councilman Greg, because they were here from the beginning. I've always talked about, I want to get data systems so we can really share our story. I know we're doing a good job, but we need and Annabelle can speak to that. We need the data to quantify and qualify why we need the money we need, why we do what we do, and how we're making a difference in the lives of our residents. Number two is just enhancing community service and partnerships. We know as a department, we cannot do it alone. Norwalk doesn't provide direct services in the traditional sense of a municipal social services, but we certainly are the collaborative partnership entity through our community resource hub. And I'll let Anna Vivian speak to that a little bit. We all know that's my son, so please forgive me for those that are watching too. And then increasing community awareness. We want our 92,000 residents to know we exist, whether it's through the health department services, through our public library services, and through the human services department services. So we're always looking at ways how to increase awareness of the services so every resident knows these services are available to them. And then number three, let me just move, this thing is in the way. Our library structure, and it was mentioned. So that is our goal. We're not in total control as a department, but we continue discussion in concert with the library board, because there's a quasi kind of process with the library board, the city, and of course UCOM and council, who will make the ultimate decision regarding budget and capital improvements. But that is certainly an area that through myself and Sherelle, we continue to have those discussions and work with the mayor's office and the administration around where we are. And so that goal still remains. And then you'll see some of the other things that is pointed out that Sherelle can speak to a little bit later. And then number four, strengthen our health department services. I think I'll leave this to Deanna, but just again, these are the 5 goals that I'm monitoring. They all have their individual department goals, but these are the goals that, provide synergy, alignment, and really integrating how we show up in our city. And then last but not least, our ADA compliance. We're again, through you and through the administration, we have a part-time ADA officer, which was vacant for a while, really looking at the budget and looking at some of those report that was done. And Anna Vivian, if you don't have it in your notes, we'd love for you to speak to how, when we ask for funds, we're also looking at where we can get funds. And so through the CCM, we have a grant for them to do our study, and that saved us $40,000. So the budget. The budget. So as I pointed out, we've had our first iteration with our CFO. I'm not sure how many of you are familiar with the process. We do meet with the CFO to talk about our proposals. And so right now, this is all proposed. And so we look at our original budget, 9.6 million. And then our requested budget as a department is 10.2. So we're asking for a budget increase of almost 700,000, which equates to about 7%. I will note right at the, this doesn't include, some of the other salary we have included that, because some of those things are done outside of what we request, union and all that. And some of you all know we're in discussions with all of that. And so this is what this looks like. So when you look at early childhood under human services, what the change was 1.9, and the department heads each have, the breakdown. So if you want to say, tell me more about why is that 1.9, they can definitely speak to that. And then Vivian is prepared to talk about, 90.2%. You're like, whoa. So she's going to speak to that. That's, 100% of increase, but we'll speak to that. And then youth services. And so overall, from the human services, it's about 21.26% increase. And again, we had our first meeting with the CFO. Literally every line was discussed, going back and forth and adjusted and so forth. So this is as is, but we have not gone through the entire process for those who have done that with BT, the whole process that we would prepare to, that we'll be embarking on fairly shortly. And then we look at the health department, and again, and Vivian be able to speak to some of these drivers. But I'm not going to look. I hope you can see it clearly. I hope, but you can see our building maintenance, 22. Our highest is preventable diseases. So she'll be able to speak to why those increases. Some of those are state regulatory. We lost some grants, and so we are proposing to keep them. Some of these grants do have a sunset date, and but we do have a team that is always aggressively, whether through our own department or through our part-time grants person, looking to how to build these services. But she'll be able to speak to that. And then our library, I'm proud to say we have some decreases, and we look at this as one budget. So, when we look at the entire budget, while we're looking at an individual budget, but we look at from a budget. So you can see that our maintenance, now minus 15%. And so we look at how do we then balance it out with other requests. And just so I just want to give a shout out publicly to the team, because we all know these are taxpayers' dollars, and as I pointed out, we take this seriously. So we're looking at, hey, maybe you asked for the increase this year, we'll go back next year. So just as a point of reference, those conversations are happening also internally, and we all meet to discuss that. And so as I pointed out in that previous slide, that our overall budget request is 7.01%. And so I'm going to now introduce our team, and they're going to speak on and highlight. And then, as you pointed out, Madam Chair, we'll do the Q&A afterwards. So I'm going to take a step back and be the slide person, and then they'll speak to some of the budget drivers. So with that said, Anna Vivian, you could just speak to introduce yourself, obviously, let them know what you do, and then speak to the slide, and then I'll go to the second slide. Good evening, and thank you, Anna V.
Thank you. Good evening, everyone. So I'm Anna Vivian Estrella, the Director of Human Services, as Lamont mentioned. And this is the breakdown of what it looks for FY25 to FY26, the Human Services budget. So you can see the early childhood program is pretty much staying flat. We're maintaining. The only increase will be a wage increase. And you'll see more of a breakdown in the next slide, but I'm going to go through a little bit of the highlights here. For fair rent, we were actually able to decrease, moving things over into the appropriate category, reevaluating some of the subscriptions we had, and just adjusting the budget properly and being cognizant, because you'll see that we asked for increases in the rest of the categories. So for human services, this is the biggest jump. For those of you that have been with us for the last couple of years, you're aware of the Community Resource Hub as a program, and that it was born out of COVID and has grown into its own identity and staple for the residents of Norwalk, where if any resident comes into City Hall, there's an online form they can call. Really, there's no wrong way to reach us. They come in, they say they're looking for food, they're looking for clothing, they're looking for case management, they're looking for just help. They can come in, meet with somebody. We make sure that we have a trilingual staff, bilingual staff, and we always have Spanish, English, and Haitian Creole represented as part of that program. And they're all compassionate and trained to make sure that they can really be very thoughtful when they meet with the residents who are seeking assistance, because it can be hard to ask for help. So with all of that being said, up until now, it was grant funded. We had the privilege and the benefit of having a private government partnership, and they held it, and they were kind enough to hold it for an additional year while we were able to adjust our budget. And so we presented for this year to incorporate and include the Community Resource Hub in its formal structure as it exists today into the budget. So this represents 3 navigators and all of the things that it takes to have the Community Resource Hub function. They go to a lot of events. We try to make sure that we're accessible, and considering the breadth of the services that they provide and that they connect the residents to, I think it's a well-justified cause, but I am also biased. You know, I get to see the residents walk in feeling really down, and then they get to meet with somebody, they get a cup of coffee, they get some water, they get to feel really nice and welcomed and warm, and they leave with a little more hope than they walked in with. And I mean, that's a blessing to be able to sit here today and say, we have a program like that in Norwalk, and it was recognized. So this program also won a Municipal Excellence Award. And I could tell you when we were upstate, we were on the stage with the mayor here, really, the presenter said they were so happy to give it, that we had the strongest application, and that they were excited to be able to help recognize the work that was done in the city of Norwalk. Of course, I invited them to come down to see us, and so we hope they'll take us up on that offer. But it just goes to show that not only in Norwalk is it being recognized as something that's beneficial, and that makes a difference. So that's what's driving this particularly big increase on the human services side. We move over to youth services, and we have a slight increase, and really it's that data piece that Lamont was talking about. We're implementing a VOC software, and we were able to negotiate the contract down to make sure that we right-sized it, but it is a slight increase to make sure that we have a strong database, and it is a structured database where we'll be able to collect data and report out data, and it will be connected to the statewide database that they're using, because they also transitioned to VOC. So we've been doing our due diligence to make sure that those systems are talking to each other, and that our data metrics and what we're measuring in VOC connects over to the state reporting system. And then the total, you can see the increase. Lamont, can you go to the next
Yes,
slide?
can you just speak to, because I don't want to, we remiss to say while we're at this point with the Community Resource Hub, the Ritter, you know, that the foundation, and it's okay to name them.
No, fair. So it was the Ritter Family Foundation and the Parent Ostrich. They were the go-to. And just to give a little bit of history, because I do think we have some new council members, you might have heard it be called Family Navigation. So Family Navigation was the original iteration of the Community Resource Hub, and it was meant to help those families during COVID times where their children weren't able to participate in remote learning, get connected to internet, broadband, and also have a tablet, a device that the children could use in order to participate in remote learning. Lamont, through his partnership and knowledge as a social worker, understood that if families didn't have Wi-Fi, if families didn't have a device, they were going to need more help than just the physical structure that it would take for the children to participate in remote learning. And so they coupled what was then called Family Navigators with all of those requests. So the Family Navigators walked the families through through the process to get the tablet, to get the internet into the home. If any of you have ever moved your internet with any provider, you know how daunting that can be. Much more complicated than it needs to be. And now we are introducing 3 or 4 different parties. So as you can imagine, it was a little bit of a complicated situation, much more complicated than we ever wanted it to be. But all these family navigators did such great work to make sure that those families got connected in the best way they knew how. And then if they had the internet literacy, right? So making sure that they knew how to get their kids connected, that they knew how to sign into Parent Square, that they knew how to use Power School, and then also all of the other community resources. Did they need more food? Were they having employment issues? Were they falling behind on rent? And getting connected to all of our wonderful community providers that have been assisting our families, but that maybe these families didn't know about, or maybe they needed to get connected to an additional program. And then the city expanded and they contributed some funds, and we had community resource specialists. And they were dedicated to the senior population and the adults only households. And Community Resource Hub merged the 2 programs. So when I came in, the 2 programs were functioning separately, but they really served the same purpose. And in order to strengthen the program, we merged it into this one program. And now each of the navigators has a specialty. So we have one person that's dedicated to keeping up to date with the food pantries. We have one person that's dedicated to keeping up to date with all of the workforce initiatives around the city. And so I can go on, but they all have a different specialty, that they make sure they have a point of contact, that they stay up to date with how those resources are being utilized, if a program's opening, if it's sunsetting, if funding changes, because the nonprofit community can change from one day to the next. You know, the funding's not always stable. So we might have a program that's helping today that's gone tomorrow, and we don't want to be sending anybody to assistance that no longer exists. And we also want to make sure they take advantage of new assistance. So when new programs come in, like the Bridge Project, we make sure we advertise it. We make sure we get it out to the community. When we did the Immigration Forum, the Community Resource Hub served a vital role to make sure that we got the word out to all of our providers along with our networks. So it's a multifaceted program, and it's really robust, and it would never have existed had our partners not invested in it, had they not taken that journey with us. So I really am appreciative to the Ritter Foundation and the Parent Astrid Foundation for investing in Norwalk. And I continue to look forward to seeing all of the great work it'll do. Now, hopefully will get absorbed into the budget. And so this is why the proposed budget did increase much more than we've ever requested. Did I cover everything, Lamont?
You got it. I
Please.
know the next slide. Can you give me? Oh boy. Can you all see that?
It's not switching over. And the next slide is the breakdown.
Right, that's what I was trying to.
Detailing.
Bummer. Oh no, don't freeze up on me. Sure what to do. It's not moving over.
I can see your mouse, but it's not switching over.
All right, let me.
Technology, when it works, it's great.
Is it
And
up
when
now?
Not yet.
All right, please forgive me. We have a dynamic PowerPoint for you.
Well, there's the slide. I can see it. Just need to go into presentation mode.
Yeah. Okay,
There we go.
there we go. Thank you all for your patience.
Absolutely. So although the percentages look really, really big, all the things that I just talked about, it's really boiling down to $226,000. It's well, $226,680. considering the amount of work that's gone into Community Resource Hub, to give you some numbers, it served over 1,000 households last year. And then when you add in all of the people within that household, all the adults, all of the children, we're looking at an impact that is in the thousands. And so investing 226,000, it seems like, again, in my biased opinion, it seems like a very small investment for all that our residents are able to take advantage of, and all that they get when they walk through the doors.
Okay, thanks, Anna Vivian.
Oh, Lamont, I know that you brought up ADA, so did you want me to talk a little bit about the
Yeah,
savings?
just quickly. Yep.
Yep, really, really quickly. I should have thought about it when we had our little intermission there. So with the ADA, that is on the capital side, so I won't talk about the funding requests that we have there. But really where we were able to save some funds in our budget with ADA is that the last time the transition plan was created was 2013. And our part-time ADA person has been working off that transition plan to really look at all of the projects, see where we're in compliance, where we're out of compliance with the existing plan. And he's done a great job, but then he became aware of an offer that was statewide, and we quadruple checked that it was going to be free to us because they're using grant money to update transition plans. And so as soon as we quadruple checked that it was not going to cost the city any money, we invited them to come down, and they've started that process. So they are sending down teams of ADA experts to review the existing transition plan and then come actually to all of our sites, all of our city sites, to update that transition plan. It's probably going to take a year in order for it to be completed because of the level of detail that this team is going into. And we'll be presenting it here, I'm sure. But that we're talking about saving the city at least $40,000 with the amount of work, travel, and resources that are going into updating the transition plan. And we're not going to have to pay anything, which is wonderful.
Awesome.
Yeah.
Come on. All right. Health Department.
Good evening.
Deanna D. Moore,
everyone.
good evening.
Can you hear me okay?
Yes, we can.
All right. Good evening, everyone, council members. And thank you, Lamont, for such a great overview of our entire department and the budget. So I'll just give a quick overview of the different divisions that we have under the health department and the primary drivers of those increases. And then I really want to focus on what our large requests are, which are related to staffing. So you'll see health admin. The primary drivers within that division are contractual wage increases related to step increases and anticipated, other contractual obligations. Within the building maintenance division, that is actually, those accounts are managed by our building management department. And so they put that request in. But just to give you a quick overview, it's related to increases in janitorial mechanical maintenance, increase in gas service, general repairs and maintenance, different alarm monitoring and inspection. So that's what's behind that increase and that requested increase. Environmental health and housing. I'd like to skip that for the next slide. I'll go over that in more detail. But I do want to point out in there, the primary drivers for this is related to a request for moving a part-time position into full-time, as well as fully funding a position that has been vacant half of this year. And that was due to the hiring freeze. So we're requesting that it be funded for the entire year next year. Sealer weights and measures, those are just related to contractual increases, as well as the same thing for our community health division, which is labeled under the medical and education services. The lab is staying the same. Preventable diseases is also related to a request for staffing, which I will go into in the next slide.
And please forgive me, I see some of the numbers, I guess when I translate it, it all kind of got combobulated. I'm looking at it now. I'm like, darn, I missed that. All right, Deanna.
Okay, so thanks, Lamont. So the big story here for the health department is, I understand this is a really difficult budget situation that we are in, and I'm trying, I really tried to work with Lamont and others on our request to truly reflect, what are the needs of the community, what are the demands that are being placed on the health department, mostly, through state and local law, and so that's what's occurring here for us. We're requesting to transition, as I mentioned, a part-time position into a full-time position in our environmental health and housing division. This position currently supports relocation and eviction services. State law has changed significantly in the area of lead poisoning prevention and control, and there are additional mandates on local health departments with an increase in childhood lead case management, epidemiology investigations, and on-site environmental inspections that are now required for children at lower levels of blood lead poisoning. And so with those significant changes, we need to ensure that the staffing is in place in order to meet those demands and to complete that critical work. I do want to point out that we do have housing inspectors and sanitarians that are trained and certified in completing this work, but it's not enough to meet the additional demands and also meet all our other mandated services. So just as a quick overview, on August 5th in 2022, Governor Lamont signed Public Act 22-49 into law, which lowered the different action levels for when a child has childhood lead poisoning. And so the idea is to intervene at the lower levels in order to protect the child's health. And so previously, when in previous years, we might conduct 2 comprehensive lead inspections, now we're looking at, potentially, depending on the data, needing to do 15 in a year. And so with that increase, whenever we have a childhood lead case and then we're doing a full comprehensive investigation, that could include hours both from environmental as well as our nursing team. And so it could involve 20 to 25 hours of environmental health staff doing inspections, collecting samples, doing epidemiological interviews, providing education regarding cleaning and general maintenance, documentation in our state system, follow-up inspections, reviewing abatement plans. So it's a lot of work for each individual case. And so that's why we're requesting that this position becomes full-time to support this additional work and support the additional staff completing the work. For clinical services, we have been really fortunate to leverage grant funding as well as city operating budgets to support our program. So we have a clinical services team that provided over 2,000 patient visits during our previous fiscal year. We have a full-time public health nurse that we were able to add to our department because we had additional funding throughout COVID, and we're able to leverage that funding to be able to support a variety of needs within the community. This position has been funded from 3 grants. We really try to leverage as much funding as we can. One of those 3 has ended, and so that position is currently funded through 2 grants. We're anticipating one of those grants an additional grant running out as the funding is running out. And so this nurse has provided childhood lead case management, childhood vaccination clinics, supported those, lead case management, and supported our active and latent TB patients. And so we've been able to, with the increased need for childhood immunizations in the community, we've been able to go from offering 2 clinics a month to 2 clinics a week. So we've quadrupled our capacity and to support the community. We've collaborated with different community partners like the federally qualified health centers, the school-based health centers, the public schools to really meet the needs of the community. We've done some recent data collection too, and we've conducted a rapid community assessment, and based on community feedback, there is still great need to look at capacity and improve, the availability of appointments, thinking about providers in the community, ensuring that they're in place to support our children. And so we want to be able to continue that and to be able to continue to support the community. And so that's why we're asking for this full-time public health nurse to be supported by the city's operating budget, because we do not want to have to cut our services. We don't want to go backwards. We want to continue to support the needs of the community.
I think you might have one more, Deanna.
Yeah. One more slide.
There we go.
Yeah. So this is I took out the building management accounts, but for the other accounts and this is really what's driving the overall increase in the health department. So you'll see about 42% of it is related to contractual wage increases. I talked about those 2 full-time staff members that we're requesting. There's also additional, Lamont mentioned some of our other grants that we have had a sexual health tuberculosis grant from the state that ended last year. And so we're looking to put some additional part-time hours on the city's budget to be able to support all of our clinics. I know some of you are familiar with our WIC program, our Women, Infants, and Children program, which is a federally funded supplemental nutrition program that's available to low-income pregnant and postpartum women, as well as infants and children up to the age of 5. We subcontract with Optimus to be able to provide this program within Norwalk. This program serves anywhere between 1,300 and 1,400 clients each month, but the funding for WIC hasn't been able to keep up with the costs of providing the program related to increase in insurance costs, for benefits for employees, for wage increases, because our employees are union, and so they get those wage increases like other city employees. And so the city, under Mayor Willing's leadership and Lamont's leadership, have really wanted the program to stay within Norwalk so that we can have that access and services for our residents. And so we've had to support that program with some additional funding from the operating budget in order to keep that program whole.
Awesome. Thank you so much, Deanna. And now at this time, our director, Sherelle Harris. Good evening, Sherelle. Welcome into the conversation.
Sorry, I was muted to keep you guys.
That's okay.
I'm willing myself not to sneeze through this.
Oh boy, I know. We all got a little something,
got over
right?
it, yeah. So thank you, Lamont, and hello to everyone. Mine is brief, as Lamont mentioned. We work collaboratively, and 1 year, one department may ask for more than the other, and then the next year it could, be in the reverse. So I do want to point out that with the maintenance, we did go down, and part of the reason, so the library is getting ready to close, and so I feel cold, so I have to tell Neil to, he's doing very well, so he's turning off the heating and everything, but I'm like freezing right now.
Oh.
Money, so yay. So as Lamont mentioned, the library is more than just books. So I do just want to highlight, the many things that we do that many people may not be aware of. So we have a really extensive database, online databases, includes like research, job searches, language learning, and live homework help. So, for people who can't find tutors, you can go on between 3 and 10 p.m. and there's a live tutor on the other end. Basically, in the grade and the subject that you need help in, you wait like 5-10 minutes, and someone's on the other end. And I just really want to promote that because it's a wonderful database, like a wonderful database. We have a great digital collection with books, movies, magazines, music that you can download free of charge. And that's going to be one of our drivers. Not so much this year, but we probably ask for quite a bit next year. We have the history room, which is an archive to the city of Norwich history. We have notary service. We are in the beginning phases of starting passport service again, and that brings in roughly, well, Ford brought in roughly 36,000 annually. We have English language learning classes in our Greater Norwalk Literacy Volunteers Department, where we have tutors, who volunteer, and we have students who come in, and it's not semester-based, and it's also free of charge. So just say someone's employer tells, just abruptly tells them, they may be working morning shift and now they need to work an evening shift. They don't lose money, they don't lose time. We just quickly shift them to another tutor. We have in-house remote access to the Social Security Administration. We have free tax preparation to Norwalk residents, particularly the low income. And that's huge because most of these services take half of the region. And the volunteers just, they work hard to make sure they get every dime of return they can, and it's free of charge. So residents really appreciate that. Cindy Lake did a phenomenal job with our annual local author festival. So there's many writers in Norwalk, who self-publish. We have a local author collection. So if you want to come in, you may see one of your friends, or acquaintances from Norwalk in that particular collection. And it's really wonderful because most people can't get agents and don't know how to get agents. So we basically are publicity for them. With Brianna's Health, we also have health and wellness programs. One thing that I think many people don't know about is we have a book librarian individualized technology class. So just say Greg Burnett gets a new device for Christmas and he's not sure how to use it, he can just call book a librarian, tell them what he's looking to learn, and he will get one-on-one help with a librarian or a library assistant. Obviously, we have craft programs and crafts for adults and children. We have our maker space, coding classes. One thing that I'm proud of everything, but I'm really proud of the Zoom programs that we have for the homebound residents. And we're in the process of adding delivery service for homebound residents. And we're also in the process of adding blood pressure cuffs that can be checked out from the library and also used within the library for telehealth. So Lamont was very instrumental in helping us with an ARPA grant, and we were able to get a pod that people can go in to study or use for telehealth. So the blood pressure cuffs were something we were interested in doing then, but it's coming to fruition now. So those are just some of the things that we do at the Norwalk Public Library. Our asks this year are minuscule. Basically, as you can look at account number 5265, which is our grounds and courts. And our pro forma was $10,000, but the city entered into a contractual agreement with Eagles, also known as the Norwalk Area Fraternal Order of Eagles, for 17 parking spaces at $600 per space. So we're contractually obligated to pay that $10,200 per year. And we've also added landscaping and snow plowing, to this ask. So someone will come in and just make sure that our yards are spruced, and we have the spring cleanup, the lawn maintenance, fall cleanup. And so that cost was $15,000. So there was an additional $25,000 in our ask. So that line item moved from $10,000 to $35,000. And our only other ask is in our book budget. So we requested a $15,000 increase to our book budget, basically to meet the diverse informational, educational, and recreational needs of our patrons. We have not requested an increase to this budget in roughly 2 decades, but during that time, as you all know, the methods to which our patrons access information and utilize our resources have evolved. the pandemic, we saw a huge increase in our downloads. So, and it's been a particular hardship with the downloads because we can purchase a hardcover book for roughly $15, but the same book in ebook format can cost us $50. So it's been rough. We have a tremendous hold. We have roughly 1,500, I believe, items that are on hold because we just can't keep up with the demand because we don't have the funding for it. So this year, we've asked for a $15,000 increase. Next year, we will probably ask for roughly $60,000 increase. And it may even go up depending on how prices are this year. But economic impact for our request is basically the cost of materials and delivery of materials has risen dramatically in the last decade, and the cost is down to us, the library, and with our growing community needs, the population has increased. So, we're seeing waiting lists for popular items, in numbers that we haven't seen in many years. So basically, during COVID, we have experienced a significant rise in community reliance on our services. And, it's sad that it took the pandemic to do it, but we're grateful or glad that people recognize, our contributions in the many services and programs that we offer. So that's basically it for our operating requests.
Thanks, Sherelle. Thank you so much. And so I'm going to just hit a little bit as we look at the total budget. So this is not an increase, but again, it speaks to the entire budget. Some of you may recall BET through an ad hoc committee. The city had grants to outside agencies. That money has now since been moved into community services through my department for now 3 years. So that's a total of about 1.5. We have not asked for an increase since 3 years ago, so it's always remained the same. But most of that is already pre-allocated or predetermined, such as the Mayor's Summer Youth Program. We do cost share match grant with the federal Norwalk Head Start, and that's $500,000. So you can see if you subtract the $500,000, we're at a little bit over 1 million. We do provide a grant to the Norwalk Senior Center, and that's about excuse me, 400,000. So when you start doing the math, you'll see, well, 1.5 seems like a lot, but when you start seeing the math, it decreases. And you'll recall last year, because I'm thinking creatively and looking at where's the need, how do we best show up and make investments, we were able to, we do about 90,000 over the next 3 years for Open Doors specifically, but what addresses Norwalk's homelessness. And then every twice a year, we do a mini grant program, which is about 100,000 give and take. And then on the senior, so the Norwalk Senior Center is different from the municipal agent. The municipal agent is a state statute where the states require the municipalities to offer senior services to low-income seniors. Now, some of our smaller towns that are 10, 15, it's a volunteer, but a city our size, I think you will agree with me, we would not be able to find a volunteer to do this. So we have, through contract and through an open bid, FCA has since been our municipal agent for elderly. And I do want to put a pin in it that that contract is up for open bid, but I'm definitely will be recommending extending their contract and maybe even extending it for maybe about 5 years, but also with understanding that obviously if an agency doesn't do right, we're able to break that contract. They've been doing a phenomenal job, and we do get feedback, and Anna Vivian oversees that. And then there's the additional 300,000. The mini grant should have been under here. I think so. It's about 300,000, and then some of the funds were able to some specialty. Let me see what I put here because I haven't looked at it in a while. I did this last year. Strategic goals are responsive to challenges or high impact. As you all know, we funded support with some Carver. Sometimes that money comes out of there. We've worked with some food programs through outside of ARPA, and that's a good point. There's no more ARPA, so all that money is gone, and so we have to be very strategic in how we show up and how we support this allocation. And so all of these programs, unless there is contract, we do have an RFP process or bidding process as outlined in our procurement process to fund this, unless there's some initiatives that come directly from the mayor's office. And so this is just another way of looking at each department's budget from last year to this year. 1.3, I think this is self-explanatory. And I want to make a note, I should have made the change. That 4 also is maintenance. So you'll see that's a little bit higher because to Deanna's point, she took out the maintenance. And Sherelle, you didn't mention the completion of the South Norwalk Library. I think most people came to it.
I'm sorry, everybody, if you get a chance, go over and take a look at the totally different library. And thank you all for the approval, to renovate the library. It's absolutely gorgeous.
And this is just another graph. I think graphs tell a story too. And you can see the difference, self-explanatory. I hope you all can see it. The library went down. My department went down a little bit. As Anna Vivian pointed out, you'll see an increase in human services based on the community resource health family navigation program. And as Deanna pointed out, the loss of grant funding and some state mandates that she is requesting. And these are the different line items of the requests in the budget. Just again, another way to see, looking at all of our departments. And so that 9.7 is more salary increases for me because the 1.5 and the amounts of the 168, that hasn't changed. The only we did a COLA last year, so we did not put a COLA in for FCA. Again, we're going to be fiscal responsible, having a conversation with FCA. And while we definitely do support COLAs, they were able to work with us within their budget because we gave them an increase last year, but next year we probably will be looking to increase because expenses go up and they have to pay their staff. And so in conclusion, we're finishing up. As pointed out at the top, is about 7% increase, which reflects operational adjustments, personnel transitions, regulatory compliance needs. Overall personnel is that community resource hub, transition from grant funded roles to full-time. Deanna also has some of those. And then it gets, again, some of those department regulatory. And again, I just want to point out that this is a proposal. But I also want to be clear that if we aren't able to fund, we do have to look at, the capacity and how to deploy staff to meet priorities and begin to prioritize so that we can do the best we can with the resources that we have. And I think that's the last slide. Madam Chair, again, thank you to Deanna, Anna Vivian, and Sherelle. We've had some tough conversations internally. But I want to thank them for their leadership and working with me and working with the CFO and mayor's office to put forth a budget. But again, this is what proposed, and we haven't started the negotiation and what's doable, what's possible. This is what has been proposed. So with that said, Madam Chair, I'll turn it back over to you for questions, and we can kind of, work through whatever.
Thank you so much, Chief Daniels. I do have some comments, but I'm going to hold my comments to allow my other colleagues to ask their questions as they begin to raise their hand. Councilperson Greg Burnett did have to ask to be excused, but he had 2 questions. So my colleagues, if you don't mind, I would like to just start with Greg's questions. And this is for all 3 of the departments. The first question is, do they have a priority, or do you have a priority item that needs funding? And if you do, what is the total budget request of that priority item?
So I think Anna Vivian, I think you know what you're going to say. So please speak. We know what the answers are.
Yeah, it's the community resource hub. That is what I'm wholly focused on. The staff just work so hard and they've done such great work. It would be a loss to the city if that's not championed. And I invite all of you, if any of you want to come and check it out, meet the staff, you're more than welcome to. Because that, yeah, so 100% hands down, Community Resource Hub, it would be my focus.
Sherelle.
Sorry, I was muted.
That's okay.
So we have contractual obligations for our grounds, but for us, it would be our book budget. And to Diane Loratello's point, a new library, but we know that's coming down the line, but it would definitely be our book budget. We just can't keep absorbing the increased cost.
Thank you, Sherelle and Deanna. Great question.
So my priority, and it's always been about staffing and making sure we have the infrastructure in place to meet the community needs. And so for us, our big item is, you know, ensuring that we can meet the state mandates for childhood lead poisoning prevention. And that involves both the environmental, you know, transitioning part-time to full-time, as well as that nurse.
Great, thanks, Deanna.
Thank you. His second part of his question, and I think you really just answered it, but I'll give the opportunity if you want to expand on it briefly. What is the program impact if you do not receive your priority request item? So what would be the impact?
I guess we should do the same order. Really, so we would lose the 3 staff members. We would lose 3 full-time staff members that are currently providing the Community Resource Hub services. And I also just want to point out that they're all Norwalk residents. So not only are they providing this vital service to the community, they are a representative of their community. And so I would hate to see Norwalk residents lose their jobs. So both the personal impact and then the community impact as a whole is what we would have if we lost the Community Resource Hub.
So for us, as I mentioned, the cost of materials and delivery of materials has risen drastically within the past decade. And so the impact is, you know, as our population increases, is that we just can't fill the books, and we risk losing people, you know, going to other libraries to get their needs met.
For us, you know, for lead, it's important. It's like a priority for me in terms of as a health issue, right? It's like incredibly important, but also from a liability perspective, like we absolutely have to meet this mandate, and if we don't, it's going to be a big problem. And so, to me, that's the priority in terms of like what we would do. And so then I would look at, all right, what are the other things that we're doing in environmental health, and what do we need to reduce in order to meet that lead need? So, you know, we've had additional things put on us over years, like services like noise enforcement, massage, massage inspections related to permitting, the therapists as well as the establishments, thinking about our food inspections, our housing inspections, our pool, like there's a whole variety of services that we do. And so we absolutely want to meet that 100%. But if we are not able to have the additional staffing for lead, then I'm going to have to look at those other areas, because both from a risk perspective and a liability perspective, you know, lead is number 1 on that list. In terms of the nursing, if we're not able to continue staffing that nursing, we're going to have to look at our clinical services, and we're going to have to say, okay, do we need to reduce the number of childhood immunization appointments, you know, that we're able to provide to the community? Do we need to reduce some of the tuberculosis, the latent TB treatment? You know, we have a partnership with AmeriCares where they're able to refer patients to us, and we're able to provide a latent tuberculosis treatment. And for those not familiar with TB, if someone has latent tuberculosis, they're not yet infectious, but a certain percentage of those who have latent tuberculosis will go on to develop active tuberculosis. And so there's, you know, so it's important that we treat people, and that's what we want to do. So we're going to have to think about, you know, those areas, and, you know, would that potentially have impact on children being able to enter school at the correct time? You know, it's all of that is taken into consideration.
Thank you for your responses. Councilperson Smith.
Thank you, Chair Ayers. Yeah, my questions, Lamont, I'm sure you can read my mind. I
Mhm.
would like to know what what the mood has been in your conversations with our CFO and the mayor regarding the community resource hub positions. I remember all too well where we were at last year. I remember, advocating for those positions with the mayor, speaking to the BET. And you ended up working really hard with the Ritter Foundation. And I really want to thank them for agreeing to add an additional year to their commitment. But I've said it so many times. All of our departments are important, right? But this department is, in my opinion, the most important because you take care of our residents. You take care of our residents who are in most need. And this is the Community Resource Hub is just, it's, we can't lose it. So what's the mood?
No, I appreciate it, and it's not just the Ritter, it's the Parent Astrid as well. They both have come together to support us. So again, in full transparency, through CFO and through the mayor, he has committed to really work with you all to make sure and to find the identified funding so that we can maintain. And that was a conversation that we've had with the two funders. And so I'm hopeful, I know, to Mr. Burnett's point, yeah, you will still have to ask the question, the what if, but I'm hopeful, and there seems to be commitment and a positive mood through the mayor. And I want to thank him, and also Mr. Tom Livingston, the chief of staff, that we're going to figure out how to make sure this program stays. And I'm really excited about that. So thank you for asking that
Great.
question.
That is good news.
Any other questions from the council? Okay, so, yes, Councilperson Dunn.
I have some questions about, it seems like from an outsider's perspective that sometimes there are things that cross over with Board of Ed things. I know we have the, some of the school-based health center things that are covered. Is there any collaboration being done or anything that you're working on together to kind of make sure that you're not both doing the same thing or can support each other?
Absolutely. Thank you for that question. So I can speak to, as the needs for childhood immunization increased under Lamont's leadership and with Teresa, really bringing community partners together to look at what is the capacity to meet the demands of the community, the needs of the community. And so frequent meetings, conversations, thinking about, all right, how can the federally qualified health centers increase their capacity? How can we work with the Welcome Center to make sure that we're getting the referrals, at the appropriate time? And so all of these different community agencies are in talks to figure out, who can increase capacity or to meet the needs. And then also how can we work together to make those linkages and to make sure we're all in communication and figuring out how best to meet those needs. So absolutely, there's that collaboration occurring, and those community partners convening to figure out how to meet the demand. And the truth is, there's just a lot of a need out there in the community, and so we're all just trying to do our part to meet that need.
Yeah, thanks, Deanna. And Deanna, I'm going to ask you to just speak to our relationship in different ways too, whether it's through David attending the suspension meetings and just the overall relationship we have with the guidance social work team to make referrals. But Heather, to your point, I'm really excited because I'm going to almost say almost monthly contact with the superintendent to really discuss, what are they doing? What is the city doing? Are we duplicating? So those conversations are being held, and I'm going to ask Anna Vivian to speak. I love how she articulates, really working with the district, particularly some of the departments around, we can help that. You all focus on this and we can focus on that, so that we're really looking at it from a holistic perspective around how do we serve all of our residents, whether they're under the school, but they're still our residents too. So, but we're making sure we're not crossing over and duplicating services. So, Anna, you can kind of speak to some of that discussion.
Lamont, part of it was, I was just kind of wondering where we're gonna see the funding or where it's gonna be budgeted for some of the things, because it seems like the community service might be the first kind of defense. Does it then go to the Welcome Center? Welcome Center coming to you, or should they be more one-stop shopping for, you know, community members? And in the sense of where we would budget.
Go ahead, Anna.
So I do just want to put a plug in there that we do collaborate with the Family Center. And I also want to just balloon it out a little bit, right? So the school is in charge of families that have school-aged children. That is a portion of the population. So any service that sounds like it's duplicative, it isn't. There's a whole other slew of residents that we have here that, you know, if they showed up to the Family Center, they wouldn't be within their purview. Our seniors, our adult-only households, our families with children that are not in the school system yet. So, right, like our early child care. And so I do just want to just tweeze that out a little bit, because throughout this department and our collaboration with our team members and our other, you know, the Board of Ed and the school administration staff, it's the reality that the families and our residents should receive help wherever they feel the most comfortable. So if going to the school first and opening that door and then working with us is going to get the family where they need to go, or the family coming to us and needing help communicating with the school staff, then we're going to do that. But we do have a community resource specialist that goes over there once a week. So we have a strong partnership. And if there is a family that shows up there and they don't really know what the most appropriate service is, or it's a little bit outside of their scope, they'll contact us. They know how to reach us, and we've gone over there as well if it's like a little complicated or we're worried that the family will fall through the cracks. So there is a strong partnership there. And to Lamont's point, we do have youth services. The director currently attends the suspension hearings. So although they're academically based and behavior based, we're there to provide that connection to mental health services, pro-social activities, other opportunities to see if we can connect them and be a little more proactive so that the behavior doesn't continue, or so that we get the family connected or re-engaged as well, because sometimes they were connected, but then they lost connection. And then I'll sit down with Mid-Fairfield Community Care Center, who provides some of the services that we sponsor, along with some of the services the school sponsors, along with some of the foundations that sponsor the services that go into the schools, and really coordinating those efforts with the clinics, with the school-based clinics, with Human Services Council and Norwalk Community Health Center. So there is a lot of coordination. We could probably spend an entire meeting talking about how we partner and how we try to be very cognizant of each other. And really flesh out some of those protocols so that we're not tripping over each other or getting each other's way, but really being collaborative and thoughtful and fluid in the way that we get families the help that they need, and also just residents in general.
And let me just add, and I'm sure if I misspeak, Anna Vivian and Chief Daniels will correct my misspeaking, but I think it's important for this committee to acknowledge and understand their work in regards to partnership. So 4 or 5 months ago, we had the press conference about the mental health gap analysis. Superintendent was right there. She partnered with this department on that. When you hear them speaking about Mid-Fairfield Child Guidance, yes, we fund them, but those children are directly serviced through the Norwalk Public Schools. They are referred by the Norwalk Public Schools. When you hear about the mini grants that we issue out and that has been overseen by this department, many of the recipients of the mini grants facilitate programming to Norwalk Public School system. So there is no blurry line. There is a strong partnership. This team has done a very conscious job of making sure they fill the gaps where they present, because the school can't do it all and we can't do it all. So it is a beautiful collaboration that I think the committee needs to kind of understand that we were a part of that. Even with our director of libraries, bringing to the attention that we now have this tutoring thing that I'm sure any student, any adult can go in and get this tutoring service. It is a partnership. We don't do the best job being our own cheerleaders, but this group does an excellent job doing the work. So I just wanted to highlight that. I don't know. I think I got it right.
I
Okay.
think you did.
You did, you did.
And I think the piece is, I think I understand what what you're wanting to understand, Councilperson Dunn, around if these services physically lived in the school, it would limit the access to all residents. And I think that's what makes, what we do unique, that what we do is open to all residents, and we're not education specialists like that, the Welcome Center, the IEP, where do you go for this, where do you go for that. Now I know that they're making
It's you necessarily, so I should be more clear about it. I think you do a phenomenal job, and I think you are the experts, I guess is what I'm getting to. I'm a teacher in North Public Schools. At some point, I as a teacher should not be doing all things. I should feel comfortable saying, you are the experts. I'm going to refer you to you. And so we've had a lot of talk about the school budget, which I know is not this meeting necessarily, but with that in the back of my mind, I'm like, I want to make sure that it lives with you because you guys are the expert. The hub should be, in my mind, the first line of defense that I refer people to in a general sense. You know what I mean?
Yeah, and I think that goes back to Anna Vivian's point.
Okay.
We put in the budget some community outreach funds so that we can go to the schools and hit those events. And I mean, I know, I don't want to be here all late with you all, but we've now had the Family Navigators Community Resource Team go to some school functions, parent nights and science fair nights, making the table and having them there available. Say, hey, this exists in your city, in your town. If you need help, come to us. So we've built kind of a brand, and the superintendent district allows us to go anywhere and everywhere within the school system. Now, we probably not have hit every school, but most certainly that is a goal, to interact with every school, as our team can make it, to show up at these events and school plays and have that Norwalk Community Resource Hub table there so families know, and teachers. I presented 2 years ago, I presented at the executive conference of the district, and it's about maybe 100 folks in the room with the principals, let them know this exists in your city. So how can we get access to your schools? And then Vivian, we're making tread to do that.
I think it was very valuable, especially when we were doing vaccines, when you guys came into the school to provide the vaccines. But that's your job to provide the vaccines, not the school's job to provide vaccines necessarily.
Right.
I'm trying to say. So sometimes it's nice for you to own it.
Yeah, and we continue, and we want to own it.
Well said.
Thank you. Thank you.
Okay. I had wrote my notes and now my notes confusing me. First of all, to say to the team, thank you for always referring back to the efficiency study. Some of us, me, Barbara, that does our heart a great joy that this department consistently takes that document and see how they can align to that document. So I need to say thank you. On behalf of the Common Council and all my colleagues, we do want to acknowledge the award. I don't think we have done that publicly. We do want to acknowledge the award that was received on behalf of the Community Resource Hub, because that work should be highlighted. Anytime someone is going up and beyond, we should highlight that. So we thank you on behalf of myself and all my colleagues. Our president is a part of our committee. We earnestly thank you for that hard work, that daily work that does not go unrecognized. We also like to thank the Ritter Foundation and the Parent Asterisk Foundation for making sure that the Community Service Hub continues to be able to be a service. And we understand that we now have to take that mantle, but we are so appreciative of those years, because it wasn't those years of funding that
Right.
we
That's
received
right.
from them that allowed us to get to this point where we could have an inclusive conversation of how we can include that in our budget. So we are very appreciative of them and their dedication. Now, I did have a question, and it's more towards the library. Does the recommended budget that we looked at tonight include the employee positions that were vacant in the last budget cycle? Is that included?
Yeah, Terrell, you're on mute. I know we do it all the time.
Sorry. Yes, it does. There were 2 positions that were made available January 1st. So yes, those were included.
Okay, so that was one of my concerns. So I wanted to make sure that was included in the budget. And then
But no, Nicole, I think they said they were going to double that.
they were, okay.
She playing. I'm like, Sherelle, we ain't talk about that.
Okay.
No, I support it though. I mean, I'm like, listen, let's go for it.
That was really my outstanding question about the budget. It was very clear to me. Me and the chief talk often, so I kind of understand the vision and the line. We did last month attend a meeting in Fairfield about bringing an additional resource that we have not yet tapped in to Lower Fairfield County, and why not it be in Norwalk? And it, the chief did open that. So we're looking forward, and it was a state kind of collaboration. So we're looking forward for that to come. But I have no other questions. I do not want to belabor this meeting. I know I don't like no long meeting. Any other questions?
May I just give some closing remarks before you all close?
Yep, let me just check with my colleagues. Mr. Sutton, Miss Councilperson Ann, any other questions? Okay, Chief, it's all you.
I appreciate it. And I'm gonna look in the camera here because I'm looking on the side. Again, I definitely want to, we as a team also grapple with this, and we understand the role that you all have, both from a perspective of looking at how you're representing your constituents, and these are taxpayers' dollars. We take that very seriously as well, as I pointed out. And I want to thank Sherelle, Deanna, and Vivian publicly again, because we've had hard conversations, and they've asked for additional requests that I had to say no, or let's put that on the table. So I do want to thank them. But as you all begin the process, we really believe that these are not wants, these are needs. These are not, specialty programs. These are programs that I think that would keep us comparable to our counterparts, our surrounding communities. We looked at best practices. We looked at what's happening in our surrounding community, and really feel strongly that the budget that we have proposed, really meets the current needs of what we believe makes sense in the current fiscal climate for our city that we have put forth. So I ask for your support as we go through this process, and myself or the team will be available if you have any clarifying questions as you all go through your process, so we can make sure you have the information you need as you all go through the process that will be set forth coming shortly for the under the legislative body. So thank you again, and thank you, Madam Chair, for your support.
As always, may I have a motion to adjourn? Councilperson Dunn, all in favor? Hands.
Thank you again, everyone. Thank you so much.
Bye.
Thank you.
Good night.
Good night.
Good night, everyone.
Good
Thank you.
night. Thank you.